Hello.
Hi.
So we've just, firstly, Norafiah has spent the last 5 minutes trying to get her scarf in the right way, but only about 10 of you are watching our videos. Yeah. So I said, don't worry, the 10 people don't care anyway about your scarf.
Right.
And we're very bright.
Look.
So
shiny.
All the other videos are a bit darker because Miss Professionals over here at videoing have been videoing at like 7 o'clock at night because we're dedicated. We are dedicated. And we've only just realised that if you film in the bright daylight...
Yeah, because the window's just over there.
Yeah, and we're two brownish people. She's less brown than I am, but whatever. So that doesn't help. So we should not film in the evening. So we're getting better. Progress. Yeah. So anyway...
Please like and subscribe our page.
Yeah, please. Because, you know, more than 10 people. Come on now.
Yeah.
Dude.
Even if you don't watch it fully through.
Yeah,
it's
just
good.
because actually it helps to show it to more people, and that, you know, somebody who is pregnant, who wants to watch us, might then find out about the video. That's right. We should say who we are after all this chatter. I'm Christabel. I'm one of the GPs. I own a practice called Samy Medical Practice in Rockingham.
And I'm Norafiah. I work here as a midwife, and I'm also a midwife in private practice.
Yes. And if you missed our other videos, we've been doing a sort of pregnancy journey sort of thing, 10-part series. Last week we talked about the second trimester, and this week we're talking about the third trimester, and we'll be talking a little bit about labour stuff in some of the future videos, so definitely subscribe. Just a little medical disclaimer, we are giving you general advice. It's not designed to take over your own health professionals, so please make sure that what you hear about in these videos, you use to tailor some of the discussions you have with your own health professionals.
Yeah, absolutely.
So now you're in the third trimester.
Third trimester, yes. So 29 to 42 weeks.
And we've been doing how big the baby is. Yep. And so essentially now the baby gets big, very big. Yes. And by 38 weeks, women, you are carrying a watermelon.
A watermelon.
It's a watermelon. So men out there or partners, you need to be kind, because a watermelon is in the belly and has to work its way out. Yeah. And that's as uncomfortable as it sounds.
Yes.
So men, be good to your ladies.
Lots of massages, lots of pampering, please, in this third trimester. It's very important because there's quite a few symptoms, right?
Yeah, there's lots of things that you might be experiencing. So you might be getting some heartburn. So we particularly, you know, tell women to try Gaviscon or to try and sit up and elevate the head of the bed a little bit. Yeah. Probably getting some varicose veins and some leg swelling. Yeah. So sometimes women use the stockings, those like travel, compression stockings. The two of us on fire. And sometimes you'll be getting some backache and tummy ache because you're carrying a watermelon and all the ligaments. So there's the round ligaments around the pelvis
and the broad ligaments
that are starting to stretch.
And you've got all your hormones in or hormones of pregnancy, like relaxin, the progesterone.
But they're all ramping up because they're like, dude, we have to get this watermelon out. Yes. So everything's going a little bit crazy. So it's normal to get a little bit of pain. Yeah. And that's when your physio or chiro or massage therapist is particularly important. Yes. Or even having baths. Men, you can help out here. You set a bath up, some candles, some lavender.
Yeah. Learn a bit of massage technique as well.
So it doesn't have to cost money.
So another rebozo stuff.
Oh, yes.
That helps. Yeah.
So there's a little scarf that you can have. Essentially, we've done this in another video, so maybe you should watch our other videos.
Yeah.
Let's keep it suspenseful.
There you go.
plug, Samy Medical. So yeah, those are some of the symptoms. So really, it's essentially to speak to your doctors because there's things that we can be helping with, nurses, midwives, in terms of managing them. So don't suffer them.
Yeah.
Come and have a word.
And in the last trimester, so there's, you know, apart from last bloods, but you'll also be offered the Group B streptococcus screening. Yeah, so have a chat to your midwife or care provider about, you know, because some women choose not to, because if you do test positive, then, you know, they offer antibiotics when you go into labour, and that can mess with your gut health. But so there are other options that you can do. And just to find out about the bacteria itself anyway. Yeah. So it's the last screening test probably that we offer in pregnancy. Yeah. So just with every other test, you don't have to say yes. It's a suggested thing, but you can definitely look into it and see if it's right for you guys. Absolutely. So what else? And then you found out that the baby can hear.
Yes,
and can taste what you.
This is really kind of cool because people sometimes say, oh, like, should I sing to the baby? Should I talk to the baby? Yes. Now's the time. Before you were just crackers and doing it, but that's okay. Now the baby can actually hear you.
Yes.
Can hear mum's voice. They can taste some of the food that you're eating.
Yes. And the babies generally respond really well. So what I do, like when the women come and they have a feel and I have a measure and just have a chat with the baby, and they usually like respond back.
And babies' kicks actually get quite forceful, because the baby's getting big. The baby's a watermelon.
Yes, absolutely.
So
and speaking of kicks, Christabel, that's quite important. So you should be aware of like what is a normal movement patterns for your baby.
Yeah, we talked last week about your baby's rhythm.
Yep.
Every baby's got their own little tune.
Yes.
You got to find out what your baby's tune is, because in the 3rd trimester, you'll know if something may be a sign of something going wrong or not being ideal based on the baby's tune. So if the baby's tune starts to differ.
Yes.
So if baby normally moves 4 times and suddenly moves twice, this is just a bad example.
Yeah.
Babies generally move more, but anyway.
Yeah, that's right.
Just giving you an easy example. Then that would be a change to the baby's tune.
Yep. And mum's instinct as well. So don't discount that. So if at any point, it doesn't matter if you've rung the hospital before and you've asked a silly question. It's never a silly question. And any signs of reduced fetal movements, you've got to go to the hospital and get checked out.
Yeah. And if you're concerned, generally I always say to patients with anything, if you're concerned, I'd rather you come in and I reassure you than you sitting at home worrying and thinking, should I call, or are they going to think I'm annoying because I've already called 3 times today or whatever. Right. You don't know what to expect or not to expect. And most doctors, nurses and healthcare professionals, I think we all would want to know if you're worried, so that we can firstly reassure you if there's nothing to be worried about and let you enjoy the rest of the experience.
Yeah,
that's the main reason.
Yeah, totally.
And so then we also thought about little things you should be thinking about. So things like birth classes.
Yes.
So we really recommend our women do some sort of antenatal classes.
Yes. And we do, so I offer them here once a month.
Yeah.
The last Saturday of every month at Samy's, or as a private session in your home. But think about doing antenatal classes, learn about labour, what to expect, what you can do.
And most hospitals, sorry to interrupt, depending on where you are, some hospitals, locally, public ones, will actually do some form of antenatal classes. Yes. So if finances are difficult, because, it's an expensive time, you're buying for a baby, that is an option that you could maybe look at locally as well.
Yep. And then also... consider doing up a birth plan as well, or a birth preference, so that when you go in to the hospital, then you can it's a list of things that you may or may not want, and so then you don't get interrupted while you're in the flow of your labour. And then your care provider is aware.
So if you're very keen on no epidural or no this or no that. So we're going to really talk about that in some detail next video.
Yes.
But just for now, it's starting to think about options and birth plans as a concept.
Yeah. And just preparing for the whole labour, because, if it's your first time, you're about to become parents. You're about to birth a human being.
Little things like getting, a couple of clothes and things ready in the house for baby. In case you go in to labour early, so getting some things organised, because then you'll feel more comfortable with the whole experience.
That's right.
So classes, birth plan, but the classes, actually we didn't mention this, are particularly important for men or partners or support partners, whoever's going to be in the labour with you. I think it's particularly important for them as well. To get their heads around what's going to happen.
And that, so then they feel like they are helping you in labour, because a lot of men don't know what they
don't know what to do.
And if they see you in pain, when they see you in pain, they kind of go, and if they don't have any tasks or know what to do, then it makes it really hard for them as well.
Yeah. So if you've done a class together, you can both communicate and get on the same page about what things you may want them to be doing, so they don't, they can help, essentially.
Yeah, absolutely.
Yeah. So classes are really, really, really important.
Yeah.
And was there anything else we wanted to talk about today?
That was it.
It's mainly just planning.
Yeah.
Planning for the birth.
Yeah.
And we I'm jesting about the baby being, like a big watermelon. It is a big watermelon. But women, for years and centuries and even longer than centuries, whatever that is, decades, centuries are bigger.
Since whenever.
Since the start of time, we've been giving birth to babies. So our bodies are capable.
Yes.
Babies can come out and do come out all day, every day from our vaginas.
Yes.
So it's not as scary as everybody thinks.
No.
And you can do it, and your body will, you know, step up when it needs
Absolutely.
to. Adrenaline will kick in.
Yeah.
So it's mainly just about planning, you know, little things if you've got, you know, birth plan stuff that you want to keep.
Just an idea, I suppose, an idea of what, you know, can happen, and just the process of physiological or normal labour.
But don't get too freaked out. We are wonderful creatures, and we've been giving birth to watermelons for ages. So we will do it yet again.
That's right.
Until you're cuddling, little baby. So that's it for this video. Next week, we're going to go into some detail about things that you might want to think about and include in your birth plan. So we'll be talking about pain options, homeopathic options, where you might deliver, and that sort of stuff. So tune in for next week's video next Tuesday evening. And again, don't forget to subscribe to our channel. Please. So we have more than 10 followers, and we feel like we're not just talking to ourselves.
No, please.
But we're really good at doing that as well. So we will keep doing it. Good night.
I don't think the video is going to stop, are they?
Yeah, because Norafiah's got all these plans to follow these videos into, you know, when you've got a toddler and, you know, common infant ailments and stuff like that. But we got to do it for more than 10 people.
That's right.
People. All right. So subscribe to our channel, and we'll see you all. Good night.
Good night.
That was